Okay, so once again, good day. This is your lesson on nutrition for special groups. Okay, so this is just a short one, okay, around 26 slides. Okay, and this is your last topic for the midterms. Okay, so special groups cover nicotine and alcohol abusers, vegetarians, and athletes. Okay, so iba-iba yung mga dietary management for these types of groups. Okay? So number one, let's proceed to those who are into nicotine and alcohol abuse. So first things first, going cold turkey. This term comes from the goosebumps people sometimes get in the days after they quit smoking. So which look like the skin of a cold turkey in the fridge. No? So some people go cold turkey because they think it will be easier to stop taking the substance right away than to taper off or gradually retreat. Okay, so in a medical perspective, it refers to the abrupt cessation of a substance dependence and the resulting unpleasant experience, as opposed to gradually easing the process. And according to Sydney Medical School's professor Simon Chapman, it's certainly the method most successful quitters use, but while cold turkey, either stopping dead or cutting down smoking and then stopping, might be the common way to success. Okay? So for smokers, no, so the already recommended dietary allowance for vitamin C is increased by 35 milligrams per day to help counteract the oxidative damage from nicotine. Smoking and excessive intake of alcoholic drinks interfere with bone health because they block calcium absorption. Okay? Excessive smoking and drinking also increases fat carried to the stomach, which may increase risk for weight-related problems. And for those who won't quit smoking, they need to eat more fruit and vegetables because many studies show that lung cancer risk decreases with increased consumption of fruits and vegetables. Okay? However, okay, you always have to remember that no dietary supplement can fix an ongoing pattern of poor food choices. Dietary supplements won't protect you from harmful effects of smoking or alcohol abuse. Okay, and supplements won't give you won't give you instant results. Now, for benefits from other dietary supplements, you likely need to take them for longer. Okay? So next we go to vegetarian diets. Now for people who like to follow this type of diet, this is a general term used to describe eating patterns that includes plant-based foods and eliminates some or all animal-derived foods. Okay, so we have your four basic types. Okay, so we have the lacto-vegetarian. They only accept dairy products from animal sources to complement their basic diet of plant foods. We also have ovo-vegetarian. The only animal food included in this diet are eggs. Okay, so please take note of the key differences. Next, we have lacto-ovo-vegetarian. So this follows a food pattern that allows for the consumption of both dairy products and eggs. And lastly, we have the vegan. Okay, so this is also known as the strict vegetarian diet, in which the patient abstains from the consumption of all animal products. Okay? Now, some of the types of vegetarians are listed below. Okay, so in addition to your vegan, lacto-vegetarian, and lacto-ovo, we also have the pescatarian diet. Okay, so all vegan foods and fish, okay, dairy, and eggs. Okay, so these are included. Okay, so please take note then of the food items that are excluded from their diet. Okay, so um, on the left column, you can see the type of diet. On the middle, you can see all the food that are to be included in the diet. And lastly, on the right, we have food that should be excluded in the diet. So, bawal sa kanila. Okay, so better if na visible yung mga borders. But for this, it's an image. Okay, so if ever you get to print this one out or you have a soft copy of this one, you may you may add borders, okay, to make it easier for you to differentiate between the columns. Oops. Okay, so there are some notable benefits when it comes to vegetarian diets. Okay, so number one, it lowers the levels of dietary saturated fat and cholesterol consumption. It also lowers the prevalence of obesity. And in patients who practice vegetarian diets, they have better lipid profiles and lower rates of death from cardiovascular disease, including ischemic heart disease and hypertension. They also have lowered risk of renal disease from high glomerular filtration rates as compared with long-term high animal protein intake in other clients. Okay, so next, it is also an effective management of type 2 diabetes, and it helps lower the risk of developing type 2 diabetes and some forms of cancer such as prostate, gastrointestinal tract, in female-specific cancers. Overall, a better quality diet for macronutrient and micronutrient intake as indicated by Healthy Eating Index. Okay, other possible benefits from following a vegetarian diet include a lowered risk of dementia, diverticulitis, and gallstones. Okay? Now, while we have benefits of the vegetarian diet, okay, we also have risks. Okay? And we also have some considerations. Okay, so because they follow a totally vegetarian diet, okay, and some may abstain from animal animal animals food sources, they may end up lacking in the following nutrients such as protein. Okay, so in a diet that lacks protein, um, a solution for this is for them to consume a variety of plant foods throughout the day, including soy products. Okay, another nutrient that vegetarians may lack is iron. Okay, so you have to take into consideration, okay, so iron intake recommendations are 1.8 times higher than for omnivores. So they need to consume high iron plant foods with dietary sources of vitamin C, which is an enhancer of iron absorption. Okay. Next, we have zinc. Okay, so the problem with zinc is that plant foods that are high in phytates bind zinc. So, medyo limited din yung zinc intake nila. Okay, so to solve this, okay, vegetarians need to regularly consume foods such as nuts, soy products, zinc-fortified cereals, and soaked and sprouted beans, grains, and seeds. Okay. Next, we have calcium. Okay, so the problem here is that oxalates reduce the absorption of calcium found in spinach, beef, greens, and Swiss chard. Okay, so vegetarians have to regularly consume plant foods that are high in calcium and low in oxalates, such as Chinese cabbage, broccoli, napa cabbage, collards, kale, okra, and turnip greens, in addition to calcium-fortified foods such as orange juice. Okay, next up we have vitamin D. Okay, so other than endogenously produced vitamin D from sunlight exposure, the primary source of this vitamin is fortified cow's milk. Okay, so a solution for this would be to encourage sun exposure to the face, hands, and forearms for 5 to 10 minutes per day during the summer, which provides enough sunlight for light-skinned people to produce adequate amounts of vitamin D. Okay, dark-skinned people require more sun exposure. Otherwise, you have to choose foods or dietary supplements that are fortified with vitamin D, such as soy milk, rice milk, orange juice, and breakfast cereal. Okay, second to the last rather, we have B12. So the problem here is that no plant food contains active vitamin B12. Okay, so you have to choose foods that are fortified with B12 such as soy milk, breakfast cereal, nutritional yeast, or use dietary supplements. Okay, and last we have omega-3 fatty acids or your alpha linolenic acid. Now, few plant foods are good sources of alpha-linolenic acid. Now, to solve this, vegetarians have to regularly include sources of alpha-linolenic acid in their diet, such as flax seeds, walnuts, canola oil, soy products, and bars fortified with DHA, or take DHA supplements that are derived from microalgae. Okay. Now, here's the thing. So, if you're pregnant and you're eating a vegetarian diet, you have to talk to your doctor about taking supplements. Vitamin B12, vitamin D, and iron can be hard to get from a vegan diet alone. Okay, so vitamin B12 is found naturally only in foods that come from animals, although some fortified breakfast cereals contain some amounts of B12. Vitamin D is most easily found in milk and many fortified foods. Spending 10 to 15 minutes in the sun 3 times a day may also be enough to make vitamin D. Now, as for iron, it can be found in beans, soy foods, spinach, seaweed, and more. Now, as a vegan, you need twice as much in the diet as meat eaters. Doctors recommend taking an iron supplement to ensure you get enough during pregnancy. Okay, so let me highlight okay, these key um, vitamins, okay, minerals, okay, for pregnant vegetarians. Okay, last topic, feeding athletes. Okay, so they have increased nutritional demands before to their due to their training, okay, especially due to the demands of their sports. Okay, so first let's go over the types of physical activity. So number one, resistance training, which is also called strength training. Okay, it helps strengthen muscles by working against weight or force. So examples of these are free weights such as barbells, dumbbells, kettlebells rather, and weight machines. You need to balls or kettlebell. Okay. Next, we have aerobic exercise. So this is also called cardio. This involves moving large muscles of the arms, legs, and hips to improve blood circulation and cardiovascular conditioning, such as swimming, cycling, and walking. Next, we have weight-bearing exercise. Now, these are exercises that forces the body to work against gravity to strengthen the bones and muscles and to improve posture and balance. Now, examples of these are brisk walking, dancing, okay, such as Zumba and roping. And last, we have activities of daily living or ADL. So, these are a collection of fundamental tasks of daily life such as grooming, eating, and toileting. Okay. Next, let's have another review or recap sa muscle action and fuel. Okay, so with regards to structure and action, these are finely coordinated series of small bundles within muscle fibers produce a smooth symphony of action through simultaneous and alternating contraction and relaxation. Okay? As for oxygen, the most profound limit to exercise is the ability to deliver oxygen to the tissues and to then use that oxygen for energy production. This actually depends on the fitness of the pulmonary and cardiovascular systems. Now, fitness level, including oxygen and fuel use, is influenced by two major factors. So, number one, fitness of the lungs, heart and blood vessels, and body composition. Okay. So let's discuss on cardiovascular fitness. Now, this is defined in terms of aerobic capacity, which depends on the body's ability to deliver and use oxygen in sufficient quantities to meet the demands of increasing levels of exercise. As for body composition, it is a reflection of the four body compartments that make up the total body weight, okay, namely lean body mass, okay, fat, water, and bone. Okay, so to add to the lean body mass, it is more metabolically active, requires more fuel than other body tissues such as adipose tissue. Okay, moving on, we have fuel sources. Okay, so definitely we have carbohydrates, specifically glucose and glycogen, and some fat. You also have fluid and energy needs, particularly fluid and energy and nutrient stores. Okay, so let's proceed to the different diets. Okay, so for the general training diet, okay, for carbohydrates, general training needs are usually met with 5 to 7 grams, okay, per kilo body weight per day. Endurance athletes have higher needs of 7 to 10 grams per kilogram body weight per day, and ultra endurance athletes require up to 12 grams per kilogram body weight per day. As for fat, fats are needed to meet energy needs, to supply essential fatty acids, and to maintain weight. As for proteins, for highly trained endurance and strength trained athletes, requirement may increase to 1.2 to 1.7 grams per kilo per day. Okay, and as a rule, athletes who are competing in prolonged endurance events should increase their energy intake from carbohydrates. Okay, so the main thing that you have to remember is that for athletes, their energy requirement is increased, okay, due to their activity. So here we have diet before exercise and competition. So first we have your carbohydrate loading. The protocol includes a moderate and gradual tapering of exercise while increasing total carbohydrate intake in the diet. Okay, so pre-game, ideal pre-game meal depends on the tolerance of the athlete. It is usually a light to moderate meal eaten 3 to 4 hours before the event, which is high in carbohydrates, approximately 1 to 4 grams of carbohydrate per kilogram of body weight, low in fat and fiber, and moderate in protein. It should also provide sufficient fluid and be familiar to the athlete, yung swak sa kanya. Okay? Next nutritional concern is hydration. So before exercise, the athlete has to establish euhydration, which is the state of being in water balance, at least 4 hours before exercise by drinking 5 to 7 ml per kilo body weight of water or sports beverage. So they have to avoid excess fluid before competition, and they are not supposed to attempt hyperhydration. Itong si hyperhydration is a state of being in positive water balance, or itong tawag natin na water excess. Okay? During exercise, they have to drink during exercise to avoid excessive water loss, which is a loss of more than 2% of the body weight. And after exercise, they have to replace fluid loss after the completion of exercise by drinking 16 to 24 ounces of fluid for every pound of body weight that is lost. Okay? Now, during the recovery phase or diet after exercise, fluid and carbohydrate replacement beverages consumed immediately after a glycogen depleting endurance event result in higher glycogen synthesis and muscle recovery than if replacement beverages are delayed for 2 hours or more. Okay, so beverages with added sodium help minimize insensible fluid losses, especially if they experience excessive sweating during their sporting event. Now, for athletes taking only a short break between events, such as triathletes, foods and beverage that are ingested should primarily contain simple carbohydrates, yung madaling maabsorb ng body nila. Okay, so athletes with at least 24 hours to recover should consume at least 1.2 grams of carbohydrate per kilogram of body weight taken over several hours from foods or fluids to optimize the rate of muscle glycogen recovery. Okay, and that ends your lesson on nutrition for special groups.